So schizoaffective is exactly as the name indicates, is a mix of schizoid or schizophrenia type symptoms as well as affective type symptoms. So you would have to have protracted episode of psychotic illness. Then on top of that, you could have a major depressive episode associated with it, or you could have a manic episode associated with it. Now, this is in contrast to, say, for instance, just simply schizophrenia, which could occur. You could have schizophrenia, but also have depression alongside schizophrenia, so that doesn't help in trying to differentiate completely between the two. You could have schizophrenia in itself, which comes with psychotic features. But in addition, we could have something like bipolar affective illness, which is an affective disorder with psychotic features as well. So they could be psychotic, and then that could also confuse things. So those are some of the key differentials that you would sometimes have to walk through before you can determine clearly that this is a schizoaffective illness. Schizophrenia type symptoms, which will be similar to what you would likely have if it was just purely schizophrenia, would be mostly psychotic symptoms. Now, for us, psychosis is usually when you experience reality in a way that would not be experienced by anybody else around you. It would feel real to you. You could hear voices like you hear my voice. You would respond to the voices like you would respond to my voice, except nobody else would hear those voices. And that makes it really, really difficult to understand your experience, and it also makes it difficult for people working with you to explain that this is not a reality as such. Right? And usually those psychotic symptoms could be experienced in any modality, any sensory modality. So if it comes to hearing, I could hear voices, but nobody else would hear those voices. Or I'm sitting alone in a room and then I hear voices. I could smell. I could have smell, odors or strong, odors at times. Again, nobody else will be able to corroborate it. I could see things, visual hallucinations, we would regard that as, but again, nobody else will be able to see that. So the difficulty for the patient who is suffering or experiencing that is they go on to respond to those perceptions as real. And that's what tends to cause a lot more of the difficulties for them. Literally, or anything could cause, would add up, to or contribute to any severe mental health disorder. Stress is a major one. Stress is implicated in all of our mental health disorders. So stress is one. Genetics is a big part of it. Usually would want to take a fuller history, family history of mental illness, and some conditions are more often associated with other conditions, so that's usually important for us to explore. Substance use could cause that, and I mean, in fairness, we don't just say substance use. It could be noxious substances, it could be any kind of environmental toxins that can also contribute to that in some way. Right? Some medical conditions would cause it. So again, if I'm assessing somebody presenting with mental health disorders, we do have to do some routine blood tests. They may not necessarily, I'm not doing the blood test to diagnose that particular illness, but I'm doing it to rule out known underlying medical conditions that can contribute to it. Interestingly, there's a huge association or comorbidity between cardiac conditions and, say, depression, and on and on. There are several other associations between known medical conditions and mental health disorders. So it's important, again, to keep that in mind when you're investigating or assessing people for mental disorders. So the impact could be anything from mild to very severe. All right. And in fact, indeed, when we're talking about treatment, we would also often look at complete remission or partial remission, or in fact, sometimes you get conditions that are treatment resistant and they're not responding. In terms of the impact, potential impact on your life, it will be mostly around your function, your job, school, relationships, family. Overall, your quality of life across all spheres could be significantly impacted. So again, that's where the social work aspect comes in. So a lot of work we do would require social workers working with us, assessing those other aspects, the psychosocial aspects of it. It would impact how you relate to people. It would impact how you cope. It would impact how your executive skills, whether you're able to go through with your schooling, and that's what sometimes would drive people to drop out of school, sometimes tertiary education, all of that. So the impact and the disability that comes from mental illness is quite severe, without a doubt. So the treatment options will be holistic. First thing we want to do is a proper assessment. Family is important. Employment is important. Housing would be incredibly important. Sometimes there are psychological impacts that follow from chronic mental illnesses like that. So they may need counseling supports. They do need a lot of psychoeducation even from the get-go. I would like to educate you about your illness, about risk factors, about early relapse signs, about medications, about side effect profiles, about the need for us to work together. I need to build a therapeutic alliance that would support you and facilitate your recovery in the best possible way. So that's a huge approach that we want to really put on online. Then, of course, the approach usually again has to be multidisciplinary. There's a psychiatrist. The psychiatrist is really there for mainly the assessments, the medications and all that. He may act as the team lead, but he's not by any means the sole driver of your care. There's a social worker. Social work involves both social work supports, housing, disability allowances, employment, all of that sort of thing. But some of them would also alongside be supporting in terms of the psychoeducation, in terms of even basic coping strategies that would get you from day to day. So social work role is important. Some teams are resourced enough and would have a psychologist associated with them. Occupational therapy is really, really critical. Again, if you're talking about rehabilitation, getting back on your feet, getting appropriate supports in re-entering the job market and things like that. And frankly, it doesn't just have to be that. Even just getting out of bed, behavioral activation, right? All of that you could do greatly with occupational therapist support. So generally, we like to look at mental health as a holistic practice. It requires a multidisciplinary team. Everybody's on board, everybody's participating, and all working, sort of harnessing individual strengths to improve the chances of recovery for that client. I'm glad we actually get a chance to speak about that, because it's meaningful for families, it's meaningful for individuals who are experiencing this to know there's hope, there's treatment. It's not always perfect. Treatments, particularly pharmacotherapy, can come with its side effects, it can come with its challenges, but beyond any doubt, it leads to appropriate wellness, it leads to recovery, it leads to rehabilitation, and people can get a life back. So it's really critical that we keep hold of that. It can be difficult for families to come to terms with it. It's even more difficult for the clients who are experiencing this. Oftentimes stigma is an experience, there's no question about it. The good news though is that's improving. There's better awareness out there, and I would encourage family members, friends, support groups to work with their loved ones and support them in reaching out for appropriate help.